I grew up here, I was born here. And as I was growing up, there were two diseases that came to Papua New Guinea. One was called leprosy, one was called TB. And when both diseases arrived here, they arrived in a very slow, but they arrived also in a very emphatic manner, especially TB. So what they did was they created isolation places. And for those of you living around Port Moresby area, in the harbour, there's a tiny little island called Gemo Island. That was the isolation ward place for TB and leprosy. So as I've worked over here as a doctor for many years now, and as I've witnessed all these things happening, we have to be very careful. We thought we were well positioned in relation to the diseases that have been faced by the rest of the world. TB, malaria have continued, but the new disease called lifestyle disease has come up in the last 10, 15, 20 years after independence. So we say that heart attack and stroke and diabetes and hypertension, they're all coming in. So those are real threats. And as we're worried about those that are now happening, especially diabetes and hypertension and kidney failure, this new disease called the virus has come along. I've talked about TB, which are a little bit stronger, bigger microorganisms, and then this little tiny little microorganism, virus, has come up and is now causing a hell of a lot of damage. Now, one of the things that you must know about is that you have relatives, you have people in your family who have those underlying diseases that I've made reference to, in particular the lifestyle disease. You've got diabetes, you've got high blood pressure, you've got heart conditions, you've got kidney disease, and all of those are. Those are in your families. 50-year-olds, 60-year-olds, 70-year-olds, your relatives, the people that looked after you. All they need is just one shot of COVID and they are gone. This is not a theory, this is the real happening all over the world. When COVID started here in Papua New Guinea last year, at the Port Moresby General Hospital where I work, Professor Vince and I are academics with the School of Medicine and Health Sciences at the University of Papua New Guinea, but at the same time we are given clinical responsibilities to do teaching, ward rounds and all of those. So we have the opportunity to witness what's been happening. So when we see patients who have come in with these diseases, and as soon as they get COVID, they die so quickly. So like I said, when the whole thing started last year, some of us were thinking, oh, well, maybe Papua New Guinea's got special immunity power that is not allowing COVID to come in. That's all wrong. That's all gone now. Hey, it is here to stay. In the last 2 weeks, the Port Moresby General Hospital is really facing hardship in trying to manage, in trying to handle this disease. If I take my medical ward, we have medical ward, surgical ward, children's ward, and all of those are. If you just take the adult ward, we've got 4 wards, A, B, C, and D. Out of all those 4, where we've admitted TB and pneumonia, malaria, and all the lifestyle diseases that I've talked about, if you take those 4 wards, in the last week we've decided that there are so many COVID cases waiting around in emergency, we should devote one of our wards to nothing but COVID. And of course, before that, a couple of weeks before that, earlier on, was the isolation ward. So we now have one isolation ward next to the mortuary with 18 beds, capacity of 18 beds. And every day, out of the 18, 16 are occupied by patients. Many of them are moderate, some are severe, and they require ventilation. So that's the isolation ward. And then we converted Ward 3B, which has a capacity of about 25, 27 beds. That's converted to nothing but COVID cases, because the emergency is now filling up. And then there's a new ward which has been converted downstairs where where the children are kept. So we got 2 or 3, maybe 4 wards that are now, that used to do normal daily clinical work, now are devoted for nothing but COVID. And of course, on top of that, you've got the Ritaflin. So if you look at Ritaflin with about 30-something capacity, 75% of them are occupied. You've got the isolation ward, you've got 3B, you've got 1C. My goodness, we are in problem. We are in trouble. And the deaths that occur, it was very sad for a 38-year-old, to come in, and because of some pre-morbid conditions, just COVID caused him or her to die so quickly. And there are many others that I could go through. All I am saying is that with regards to the clinical side of COVID, it is to be taken seriously. So we come to the stage where we've got to prevent it from occurring. So prevention is better than cure, is what we will hear from, because that's where the vaccination comes in.